As usually, friends, let's start from the definition of the problem. What does it mean, amputation? Of course, in the 21st century, we cannot say that this is the choice method of the treatment. Of course, we must do our best to save the extremities. But unfortunately, until now, you will see that in many cases, different cases, we need to make this very big, very traumatical, invalidizated surgical performance because it makes the invalidization of the persons. So write the definition, please. Amputation, it is the surgical removal of extremities in the level of the bones. In the level of the bones. This is very important, this last point, please, mark in the level of the bones. And let's make the logical now some investigations. Tell me, please, except the level of the bones, in which other levels we can remove the extremity, if not in the level of the bone? Joints. Thank you very much. Now, tell me, please, in your opinion, what will be the basic difference between removal of extremity in the level of bone and in the level of the joint? Technical difference, yeah, specificities, what will be different in your opinion? You have two patients. For one, you should remove the extremity in the level of the bone. For another, you should remove the extremity in the level of the joint. What is the difference?
The bone structure.
And also the lymph can also.
The lymph can be.
Like the parts.
Friends, why you keep your brain? Why you don't use it? If I will remove extremity in the level of the bones, I must sew the bones. If I will make removal of extremity in the level of the joint, I must cut the ligaments, which is fix the joint surfaces to each other. It's a bone doesn't need to be sewn. Do you understand me or no? That is the main technical difference between amputation and another manipulation, which is called exarticulation. Let's say open the brackets and write please. Removing of the extremity in the level of the joints, we call exarticulation. Exarticulation. And the basic difference between amputation and exarticulation connected with the work with the bony structures. In case of amputation, you sew the bony tissue. In case of exarticulation, you cut soft tissues. So you don't need any saws. You don't need to make the sewing of the bone. From that point of the view, of course, these two surgical performances is totally different from each other. Now we need attention to me. Little bit, I'm very shortly, briefly right here about the manipulation, little bit about history, guys. You know that investigations in the field of the history of the medicine show that this is, together with traphinations, one of the oldest surgical performances which we know from the historical some sources. And especially importance of this problem increased in case of some wars. Because you understand that the crash of the extremity, huge traumas, damage of the big vessels, especially in ancient old time, that the peoples didn't know how to ligate the vessels, how to arrest the bleedings, how to make some life-saving procedures. Of course, in that time, the choice manipulation, it is to cut the extremity. And this cutting of extremity in that time provided in very crude, we can say, single-step method. Such kind of amputations nowadays, we call the guillotine method of amputation. You know, guillotine, it is the big knife which is used in the ancient times to cut the head of the peoples. Yeah? That's a guillotine method of amputation means that you cut the extremity in one level. and the soft tissues, and the bones, and everything. You cut in one level. Usually, in the old time, in your opinion, how after this procedure try to arrest the bleeding? Usually by burning of the tissues. You understand that the burning of the tissue gives the constriction of the muscles, and smooth muscular fibers also constricted. Thrombosis happen. Unfortunately, many people after this procedure die. Point 1 due to the shock. Point number 2, due to the secondary bleedings, because you understand that if the big vessels doesn't ligate it, the chance to give the secondary, what does it mean secondary? It means not immediately after performance, but time ago. Of course, you understand that due to the time, the pressure inside of the vessels will be increased due to physical activity, anything else. Yeah? And of course, it can give the provocation of the new bleedings. And no one will not be responsible in that case to arrest the bleeding from the femoral artery or popliteal artery or something like this. And of course, point now to say, look, shock pain, bleeding, and number 3 cause of the mortalities in ancient time. Shock pain, bleeding, and number 3, infection. Infection. To tell the truth, investigation in these 3 fields, it is now in the base of the new scientific medicine which we have nowadays. It is investigation of the anesthesia, investigation of the methods to arrest the bleeding, and investigation of the antibiotics, aseptics, antiseptics rules to prevent formation of the. Generally, we can say that all, we can say nowadays surgery, it is based in these 3 investigations. Unfortunately, of course, in ancient times, in my opinion, we don't have exactly some sources to say, but 90% of the people died due to this manipulation. I mentioned for you the rules of this mortality. Of course, from old times, we know, for example, in some medical sources that people know about the tourniquet appliance methods. Tourniquet appliance method can give the temporal arrest of the bleeding. Of course, if you make it properly. By the way, in your examinational questions, you know, starting from this maximum next week, we will go to the surgical room. There are the rules how to apply the tourniquet. Remember forever, guys, tourniquet is applied only in the region with the single bone.
Yes.
Regions with more than one bone, we don't apply. We apply tourniquet proximally to it. In the region with single bone. Otherwise, vessels and nerves, vessels now, because nerves is not important, goes to the interosseous spaces. And you cannot increase the pressure inside of the interosseous space. Manipulation in the region with double and more bones, I mean the tourniquet appliement, doesn't give any results. Okay, if it is understandable, guys, about history of the amputation, if it will be interesting for you, I have a lot of the literature about it. Unfortunately, I don't have time to speak about Vesalius' work, Galen work, and some other ancient doctors, but believe me, it's very interesting. If you want to go deep and want to study it, please come to me. I will give you the literature, nor any problems. You can read it for yourself. Now write, please, the indications for the amputation. Indications of amputation. Divided into 2 big groups. 2 big groups. Group number 1. It is primary indications for the amputation. Primary indication for the amputation. Open the brackets and write, please. This is the manipulation which is performed in the emergency indications. if the problem doesn't have any other methods of treatment except the surgery. It is performed in emergency conditions or indications if the problem doesn't have any other treatment except the surgical. Open the brackets on right, please. For example, big traumas, if replantation is impossible, or for example, congenital malformations. Of course, I cannot by medicines treat the congenital malformation. Today we have some orthopedical surgical performances, but sometimes it is impossible if we don't have extremity. The child is born, for example, with genetical defect, no extremity, only short limb we have from extremity, which is decrease the possibility of the prosthesis. So we sometimes need to do this performance because the prosthesis in that condition is much more effective and make much more social adaptation of the patient comparable with this short, unuseful, stump of the extremity. Yeah. Right, please. Point number 2, secondary indications for amputation. In the brackets, right, please. If organ-saving therapeutical and operational methods is not effective, organ-saving therapeutical or surgical treatments is not effective, we need the life-saving surgery in any period of the treatment time. In any period of the treatment time. If you see that you lose control from the situation, if you see that the development of the problem stands dangerous for the life of the patient, you make the decision to make of surgical performance. Minute attention, what about is it? Now let's take the same traumas, but now the trauma which is possible to treat it without amputation. For example, the consolidation of the bones, usement of some metallical construction, recanalization of the vessels, and blah, blah, blah. Replantation, but you make replantation, you suture the disconnected part of the extremity, but you see that during time, you don't achieve your goal, vessels doesn't normally supply the region, it gives the necrotizations. You understand that your primary treatment, which is directed to save the extremity, unfortunately doesn't give the result. Or, very common problem, which I want to mention a little after we will discuss, some metabolical disorders in the region of the foot. For example, in case of diabetes mellitus, formation of the ulcers, diabetical ulcers. Of course, guys, no any doctor will not start to treat this situation by amputation. You will do your best, first of all, to compensate the metabolism, to make the treatment in the region of the ulceration, which is increase the possibility of the regeneration. If it is necessary, you will use antibiotics and anything else. But if you will see that you don't achieve your goal, and here we have gangrene or we have necrosis in any time of the treatment to save the life of the patient, you will finish some conservative or surgical treatments which is directed to save the extremity, and you will make amputation. It's like this is the difference between primary indication and secondary. In case of primary indication, you start from amputation. In case of secondary indication, you come to amputation because all another methods doesn't give the effect. And finally, what you must do, it is amputation. Right, please. There are third indication also, which we call re-amputation or repeated amputation. Re-amputation or repeated amputation. In the brackets, right, please, it is amputation after amputation to make the formation of in the brackets write please, ideal stamp, if previous results is not sufficient, and you cannot make the normal prothesing of the extremity. Unfortunately, guys, any next reamputation decrease the social adaptation and decrease the movements inside of the stump of the extremity. We must do our best to save maximal length of extremity. Because the shorter will be the extremity, the less will be the movement possibility inside of the prothèse. Let's say you will do your best to not make mistakes during the surgical performance, to not provide the reamputation. Which kind of mistakes, of course, I will introduce for you after. But you must do always your best after amputation to achieve so-called ideal stump. The stump which has all necessary qualities for the future prothesing manipulation. And which kind will be this stump, I will introduce for you a little after. Now, right, please, incidence of the problem. Nowadays, during the year, we make approximately 10 million amputations. 10 million amputations. Open the brackets and write, please, 65% become to the lower extremity. Approximately 35% become to the upper extremity. The average age of the persons, it is 50 plus. More than 70% of the peoples, it is peoples after the 50 years. And approximately twice more common nowadays for the males. A little bit even more. I write here 75% it is the males, 25% it is the females. And primary, guys, of course, it is connected with professional activities. You understand that usually in hard physical works, we have the involvement of the males population.
Yes.
And of course, due to this, and we can say driver's traumas, we can say professional traumas, we can mention, why not, some sporting trauma, usually the mechanical sport, some driving, I don't know, motorbike drives and anything else, which can rudely damage the extremities. Of course, mainly we see the males population, which is included in these activities. But generally remember, please, 70, 75 into 30, 25. Approximately, this is the incidence of the males, incidence of the females. Now, right, please, in the statistic of this problem, before 50, 55, mainly it is the peoples with the traumatical disorders. Mainly it is the peoples with the traumatical disorders. After 50, 55, it is the diseases. In the brackets, right, please. Number one, which is destroy the metabolism and vascularization. Which is destroy the metabolism and vascularization. Number two, it is the tumors. Number three, it is the necrotizing infectional disorders. They can be associated with trauma or no. Necrotizing, for example, gangrene. It's need to be mentioned, guys, many attention to me, that such kind of the necrotizing infections usually connected with two kinds of the situation. In one case, they can be post-traumatical. In another case, they can be due to the abnormal vascularization. Let's say that is most common cases of infections. Just isolated infection by itself, it's very seldom. Usually it is associated or by the trauma or it's associated with the problem with the lower vascularization, like metabolical disorders, angiospasmatical problems, thrombosis of the vessels, especially, after 50-55 for the males with smoking peoples, we can have Lariche syndrome, obliterated endoarteritis, thrombosis of the internal vessels. This is the risk group. Why males? Because the bad habit like the smoking, it's much more common for the males. Yeah? And you know that the nicotine and substances which is located in the smoke, they provoke the vasoconstriction. Vasoconstriction, if it is chronic and long-term, it is damage the intima of the vessels. And in damaged intima of the vessels, during the time, we see the thromboticization. So this is the pathophysiology of formation of the trauma. Long-term spasm, damage of the inner lining of the vessels, it makes it not smooth. If it is not smooth, different kinds of the aggregation we will have. From platelets aggregation up to formation, for example, atherosclerosis. Anyhow, the vessels will be closed finally and we will achieve disorder. Diabetes mellitus, which is, primary damage the microvascular network, the capillary network. How it is damaged the capillary network? By the sclerotization. It's made the active sclerotization of the capillary network. Due to this, the supplement of the tissues is decreased. We achieve, for example, the necrotization, ulceration, especially the region of the foot. Why region of the foot? Because this is, guys, the most problematical region from the point of the view of the supplement. And especially I want to mention here the venous drainage, because you understand that it goes opposite the gravity forces. So now imagine that part of this venous network will be sclerotized. Of course, from that point of the view, the chance of formation of primary, for example, lymphadenopathias, swellings, insufficiency of the veins. After it will give formation of thrombophlebitis, for example, and thrombus of the vessels, and finally we will achieve disorders which I mentioned. Anyhow, remember once again, let's say we have the problems which is primary, we have the problems which is secondary. We have the problems which is connected with traumatical disorders, and usually it will be the problem of the younger peoples, because you understand, we don't have usually sportsmen after 55, 60. And samely in the factories, we don't have the 80 years old people who is working the hard physical works. Usually this is people before 50. Vice versa, after 50, instead of the traumatical disorders, we will achieve the vascularizational problems, metabolical problems, different kinds of infectional disorders, and then anything else. Finally, right, please, in the last position, it is the congenital malformations, which is divided into two big groups. A little after I will introduce it for you. Right, please. Group number one. It is abnormal development of the extremities. In the brackets, right, please. Shortening of the extremities. Unfunctional extremities. And group number two, then we have the additional some structural units like the polydactylia. And of course, in that case, situation much more easy. That's why we make amputation of only some distal structures like fingers, for example, And of course, situation is much more better in that situation. Okay, I described for you the main indications. Little after, one by one, we will try to discuss each one, which I mentioned. But anyhow, despite the cause of the amputation, as I said before, after amputation, you must to achieve so-called ideal stump. And right now, please, ideal stump definition. This is the stump, which is absolutely congruent to the prothese and will make the maximal functionality of the prothese with the maximal chance of the social adaptation of the person. What is the main characteristics of the ideal stump? Number one, maximal length of the stump. Maximal. In the brackets write, please, the more joints you will save, the better will be the functionality of the prothese. Number two, end of the stump should be maximally smooth and possibly round. In the brackets write, please, no any angles. Number three, stump should be maximally strong and firm without any abnormal movement under the skin. In the brackets write, please, the wormy-shaped movements of cutted muscles. Wormy-shaped movements of cutted muscles. We need attention to me. This is one of the biggest problems, guys. If you cut extremity, or then you cut extremity, you understand that your cutted muscles will lose the connection with the bones. That's why, of course, after this manipulation, they cannot make any productive movement because the place of attachment to the bone is loose. That's why what will be happen with these muscles? During constriction of them, they will make abnormal wormy-shaped movement under the skin without any effect. And this is understandable for you guys because they lose. For example, normally I must be connected with this cell phone. Then I will make, for example, now flexion. Cell phone from the table will become to me. If I lose this connection, guys, my work will not be effective from the point of the view of the movement of this cell phone. And I will make just some unnecessary movement under the deep structure, under the superficial structures. In the brackets, right, please, to prevent such kind of the disorders, we make stabilization of the cutting muscles, stabilization of the cutting muscles by the suturing of antagonist cutting muscles to each other. By the suturing of antagonist cutting muscles to each other. In the brackets you can write flexor with extensor, adductor with abductor, and something like this. Why it is necessary, guys? Look to me. Then you connect it absolutely antagonist muscles to each other, the final work of them will be zero. One will compensate it another, yeah? Because tonus of these structures usually equal to each other. And that will prevent any abnormal movements under the stump, yeah? And will make possible the prothesing of the extremity after the manipulation. Otherwise, guys, you must understand, look to me, guys. You form some stump. The stump will be inserted usually after in the prothese. You must do your best to have some constant form. If the form will be changed during some activity of the patient, it will be impossible to create size of the prothese which is necessary for this stump. You must to have the constant size. Now let's imagine that, for example, diameter of the size of the stump, it is near the, I don't know, 20 centimeter, but then the stump is moved, it is become to 35 centimeter. Of course, you understand that fixation of this stump inside of the prothese will be impossible or hardly possible. or ineffective. Next point, right please, the tip of the stump should be maximally smooth, and the resulting scar should be possibly in surfaces of the stump, not in the tip of it. Should be maximally in the surfaces of the stump, but not in the tip of it. In the brackets, right, please, that is necessary to avoid overpressure into the scar and to prevent the secondary vascularizational problems inside of the scar tissue. What does it mean? Pay attention to me, guys. Let's remember together what is the scar. It is the overproduction of the connective tissue. Inside of this connective tissue, primary vascularization is not enough. Now, if this scar will be overpressed during, for example, some physical activity of your patient, of course we can achieve here trophical disorders. Why trophical disorders? Generally, to tell the truth, not only due to the undervascularization, but also due to the insufficient innervation. That is two problems which can give the trophical disorders in the scar region. I think you understand and imagine that your normal tissues is much more better supply and much more better innervated than any scar of the human body. And what I must do, for example, if it is my pressure surface of the stump, I must do my best to not have here the scar. I should move it in the sides of this stump to decrease the pressure in the scar region. So keep it in your mind and remember, final scar always must be in the place with low pressure, not in the place of the high pressure. Next point, right please, the stump should have normal here in the brackets, yeah, enough, let's say, enough vascularization and enough innervation. Enough vascularization and enough innervation. Otherwise, of course, guys, 1 minute attention to me. You understand that then you make amputation, you make the ligation or suturing of the vessels. Here, there are big problems. You must not ligate the vessels, which supply your stump. You understand me? Otherwise, how we can imagine? Unfortunately, I don't have here the desk to draw for you. Now, let's imagine the situation. Look, everybody, to me. For example, this is the level of the stump. It is the artery which is located inside of the stump. You must ligate it distally of the last key structures. Distally, not proximally. Because if you will make its ligation proximally to the last key structures, it will become to the necrotization. Idea is understandable. Do you understand what I tell you? They say this is critically important, guys. You must to understand the place of ligation of the vessels. By the way, from that point of the view, any amputations we call angiosurgical and neurosurgical procedure. Because the most important point of any amputation, it is correct work with the vessels and correct work with the nerves. Otherwise, you can beautifully provide your surgery, you can form very beautiful and great stump, but after 2-3 days, it will be necrotized. One of the most hard problems, which I will introduce for you several minutes after, it is to make correct decision of the level of amputation. And believe me, it's not easy. From one point of the view, as I say, you will do your best to maximally keep the length of the extremity. From another point of the view, you must understand that all damaged structures should be removed.
Yeah.
And you will work in the press, let's say, of these two rules. From one case, maximally remove the damaged structures. From another case, maximally keep the length of the extremity. Right, please. Next point. We should not have any spars of the bone in the tip of the stump. And we must make the complete closure of the bone with enough thickness of the soft tissues to prevent the crushing of the stomach. Minute attention to me, guys, that is very important. Let's remember what I told you several minutes before about ancient highlighting methods of amputation. Now, use your imagination and imagine what will be happen if you will cut the extremity in one level. What does it mean in one level? It means everything. We take some wind sharp, tick, we cut the extremity. But unfortunately, we will have absolutely abnormal stump after this. Why? Easily, guys, because our soft tissues, after exactly cutting, will be compressed, will go to upwards, and in the tip of the stump, we will have the bone. Because, of course, bone doesn't have any compressional effect. It cannot be tense and goes to upwards. Soft tissues after the cutting will goes to up. By the way, maximally skin. Second, it is superficial muscles and minimally deep muscles, because deep muscles is firmly fused with the bones. That's why what we will have stairs, several stairs. In highest most position, due to the constriction, will goes the skin. In middle position, we will have muscles, and in lower position, we will have bone. What is the main problem of such kind of the stump? You don't have any enough soft tissues to close the bone and to prevent, compression, crushing of the stump during the physical. You generally cannot close the bone. And if you will leave it in that case, of course, after several times, it will give the necrotization, osteomyelitis, infection of the stump, and the person will be died. Or you must make the new reamputation with the shortening of the extremity to achieve the ideal stump by all necessary qualities which I mentioned for you. Let's say keep it in your mind and remember, guys, all our soft tissues have the tension coefficient. For example, skin in your thigh region, mainly in the medial surface, can be tense up to 6-8 centimeters. Do you imagine what this means? You cut skin in that level, and after several minutes, it will go 6-8 centimeters to upwards. That's why when you decide the level of amputation, you should keep it in your mind that tissues, soft tissues, after cutting will not be in the same place. They will be constricted. And this constrictional coefficient for all your soft tissues in all different regions of extremities, you must know if you will work in the traumatology. Otherwise, it will be totally impossible to make the ideal stump, which is necessary for the future prothesing of the extremity. Last point, right, please. Tip of your stump and the scar which is formed in the stump should be fully movable, should be absolutely closed in the brackets, right, please, no any ulceration. Complete skin covering of the deep structures, and minimally adhesion of the scar to the deepest located structures. What does it mean, guys? Pay attention to me. Of course, if I will take all tissues and suture them together to each other, not by the rule which I teach you, layer by layer, but if I will connect it, all the structures during the suturing to each other, of course, the scar, which will be finally in the skin, will be connected with all deepest located structures. It will be unmovable. It will be not elastic. It will be connected with the deeper structures. In that case, the possibility of the metabolical disorders, abnormal supplement, and anything else will be much more higher. And during the movement inside of the prothèse, we can easily achieve the problems with the vascularization, with the necrotization of the stump, and formation of the ulcerations. They say we must to make maximally movable, I means not connected with the deepest structures. Otherwise, then you take this skin, you must to be possible to make the skin fold and to make the movement of the skin here. In that case, you can see, let's say, all these rules, remember please, it is belong to the ideal stump. Now, very quickly, attract your attention into the pictures. I will introduce for you main causes. As I say, we have traumatical and we have non-traumatical problems. Traumatical problems, guys, as I say, 30% it is upper extremity, 70% it is the lower extremity. Peoples, which is usually in reproductive age, it is not old peoples, mainly it is the males, different levels of the trauma, different tissues which can be traumatically disconnected. In case of the traumatical amputation, two choices we have. Choice number one, it is so-called replantation. We will speak about it. What does it mean? You try to suture the extremity, of course, by all its layers, all the vessels and all the nerves which we have here. Again, it is connected with the size of the cutted extremity, with the time of your surgical manipulation. Because if you will do it late and vessels will be traumatized, of course, the effect of your surgical replantation will be not high. By the way, last investigations show that approximately effect of replantation for upper extremity below the cubital region, it is near the 35-40%. Above the cubital region, it is near the 30%. Let's say more distally region is disconnected, the more higher effect. And of course, complete connection with the time factor. Usually, most effective cases of the replantation, it is then you make it after 10 up to 15 minutes after the traumatization. The more will be lose the time between the trauma and between your manipulation, the less will be effect of your manipulation. In the lower extremity, percent is lower. Below the knee region, it is near 20-25%. Above the knee region, it is less than 20%. Effectiveness of the replantation. And here there are second problem also there. Of course, always we must to make the organ or region saving surgical performance. But keep it in your mind that sometimes after replantation, we achieve the hip extremity, but usually effect of the movements inside of this extremity will be critically decreased. That is connected with abnormal innervation, that is connected with abnormal scarification of deeper located structures. When you make the suturing of the muscles, guys, you can easily lose their function. Because totally whole muscles will be destroyed, and then after the suturing, they can easily fuse to each other, which is abnormal, and function can be lost. And in that point of the view, guys, you will have not so easy choice. What to do? To keep the extremity, but to have decrease of the functions, or to remove extremity and to use the fantastical protheses which we have nowadays, biomechanical, for example, which is make the total, not say total, but the maximal, for example, stimulation of all necessary movements inside of the extremity. That is also not easy choice. Unfortunately, in all my practice, I didn't see any replantation with total restore of the function of the extremity. I didn't see. And in the literature, we don't have such kind of examples. Unfortunately, then you make this total connection of part of extremity to its previous place, you lose the functionality of the muscles. And that is the biggest problem, guys. Don't forget that my subject, it's not about the, some indications, etiology, pathogenesis. Of course, in the future, you will have your surgical diseases, the traumatology, and all these questions you will discuss in the future. I just need to speak about the technique of the surgical performances, which I will introduce for you a little after. But keep it in your mind. Make the choice between amputation with future prothesis and replantation. Nowadays, it is not easy. Previously, of course, then we don't have so good protheses. We don't have any choice. Of course, we try always to keep the extremity. But now again, I say, we have fantastical protheses. And what is better in that case, to save extremity without function, or to form the normal stump with the future prothesis, it is the big problem. Anyhow, look here, please. Then we speak about the non-traumatical problem. Majority of the disorders, as you can see, connected with the abnormal vascularization. Lower extremity, 70% of the amputations, upper extremity, only 6%. I told you before, again I want to say, from the point of the view of the vascularization, the most problematic part of the human body is the lower extremity. And keep it in your mind, guys, our age doesn't make us more healthy. And the main primary problems which we achieve during the age, it is the vascular disorders. It is portional or total obstruction of the vessels due to different causes. Don't think that only our coronary vessels can be closed. No, any our vessels. Why you think that coronary vessels can be so easily closed, but extremity vessels, they also can be very easily closed. And we achieve exactly after this, the necrotization and ulceration in the region of the extremity. Is it the primary indication? No, of course not. It is stupid to say that if there are a vascular disorder, you will start to make amputation. It's stupid. You will do your best to restore the circulation of the blood. How? Standing manipulation, shunting manipulation. Why no? Conservative treatment, vasodilatators, I don't know, statins, which is decrease the level of the cholesterol inside of the body. Different anticoagulants, which is decrease the coagulational rate inside of the vessels. Different kinds of anticoagulants, which you study in your pharmacology. But if finally your conservative method will not be enough, if invasive manipulation like the standing procedures and anything else will not give the result, if you see that the extremity go to the necrotization, of course you will choose the surgery, which I mentioned before. Until now, by the way, I didn't speak about my subject. I try to explain for you situations which is need to make it, which you will study in the future. Let's continue, guys. Next slide is also awful. You can see the formation of the gas gangrene. Usually it is the anaerobical infections, and you can see that the big blisters is forms in the extremity, which is contain methane, some other gases, yeah. I don't know, different Klebsiellas, I don't know, Yersinia pestis, different other kinds of the microorganisms, yeah. Pseudomonas aeruginosa. This is the anaerobical infections which is make the gas gangrene. What is the cause of the gas gangrene? Another question. In majority of the cases, in the old peoples, it is vascularizational disorders. For the young peoples, it is traumatizational infections. But anyhow, then the gangrene is happen. Remember, guys, until now, and I'm sure in the future, nobody will not be responsible to return the dead tissue into the healthy tissue. If the tissues is die, final what you should do it is to cut and remove them. Of course, you can do your best. Hey, don't sleep. Hello. Hey. You should do your best to prevent the necrotization of the structures. But if this necrotization is happen, the single option which you have, it is to cut and remove them. I don't want to speak about treatment of the gas gangrene. Of course, in the position number 1, it will be antibiotics. Of course, in the positions number 2, it will be detoxification. If it is necessary, extracorporeal methods of the detoxification, which you know very well. For example, hemodialysis. Of course, it is the big incisions on the extremity because we must do our best to provide it oxygen maximally to deep side. And we make so-called near-fascial incisions because if the muscles and fascias close the spaces, oxygen generally doesn't go to inside, and these microorganisms, anaerobic microorganisms, effectively live inside of the tissues and effectively make the necrotization. Of course, in the future you will study it. I don't want now to speak. Problems which is connected with the thermal traumas. The burns, for example. It is also the big group. Frostbites. That's why we can have under cold influence, we can have under high temperature influence. In any case, it makes the necrotization of the tissues. Usually, you can see in both cases, we have the coagulational necros. Coagulational necros make the mummification of the tissues. Vice versa, palliative necros, as you remember, you study from pathology. It is make the softening of the tissues, make the so-called soft cheese form of the necrotization of the structures. Then structure doesn't keep. We have the total liquid form of the necrotization. Here we have coagulation, dry form of the necros. This is also an indication of the problem. Finally, I show for you 2 disorders. It is the tumors, the bone tumors. It is the different kinds of the sarcomas, tumor of the muscles, which is also with the metastases, guys. Unfortunately, final surgical performance here will be the amputation. Because you cannot separately remove only the tumor. It gives the spreading through the all soft tissues of the extremity. In oncological practice, surgical rule is simple. Maximally remove the structures, oncological structures, inside of the healthy tissues. You remove more than necessary to prevent any micro evidence of the cancer. Friends, then you look to the oncological problem, you see macro evidence of the cancer. Then you make the histology, you see micro evidence of the cancer. Of course, in the base only of histological and another microscopical investigation, you can be able to put diagnosis of the cancer. Because macroscopically, you see the volume. You don't know what is the cause of the volume, trauma, infection, parasital disease, and anything else. You must to verify the diagnosis microscopically. But then you make microscopy, guys. You take it usually from one locus. You cannot take it from whole human body. You cannot take it from all neighboring structures. It's like to not leave micro evidence of the cancer in the place of its localization. We make the over resections. We resect it more than it is visible and necessary. In case of extremity, the best surgery, of course, it is amputational surgery. If it is impossible to keep the extremity, if you don't have the localized cancer, if it is spreading cancer, we call it the metastatical cancer. In that case, it is impossible to save the extremity and you just look in the upper pictures. You can see congenital disorders. different levels of abnormally developed extremities, or if there are the multiple structures, or if, for example, in case of the syndactylia, the fingers is fused to each other. Of course, it's not so big problem in the upper shoulder cases. It's much more big problem if whole extremity doesn't normally develop. For example, bones is absent, or ossification is not happening.
Yes.
So in that case, unfortunately, guys, this kind of extremity in the future will not have any functionality. And you must to make the choice, what is the better? Here to make, for example, some orthopedical manipulation, to try to make the enlargement using the special orthopedical apparatus, yeah? Or you need to make the amputation with the future prosthesis. Generally, remember, please, we must to do your best to not make the amputations in the childhood. Because as you understand, the more early in childhood you will make the amputation, the less developed extremity will be in the region of the stomach. And in the future, the possibility to make effective processing of this extremity will not be high. In the future, you will study the orthopedics, all these questions you will discuss, of course, but keep it in your mind. Generally, the pediatrical age, it is not the best time for the amputational surgeries. If it is understandable for you also, let's come to the biggest problems. Now I will speak about technique of the surgeries. We will speak about type of the surgical performances. Write, please, the intraoperative principles of the amputation. Number one, nowadays it's forbidden to use the local forms of the anesthesia for this performance. In the hospitals, we should use only and only general anesthesia. In the brackets, write, please, exception if you make the life-saving surgery outside of the hospitals, for example, in some war conditions, in some catastrophic cases, anyhow, if it is not in the hospital. Number two, maximal hemostase of the region. In the brackets, write, please, the tourniquet appliement, exsanguination, clipping of the biggest vessels, in the brackets, write, please, all big vessels must to be separately accessed by their projections on the place of locations and separately prepared before cutting of the extremity. That is the most important rule of the surgical performance. What does it mean? Usually you think, I will take and cut. After the cutting, I will see the fountain of the vessel bleeding, and I will find the bleeding. It's forbidden. And I will tell you why. Several vessels after the cutting, due to the constriction, primary will not give the bleeding. And you will not be able to find these vessels and to ligate, to prevent the secondary bleeding. Why it's happened? Number one, it is constriction of the vascular wall. Number two, constriction of the neighboring muscles. Muscles also can be over-constricted, can press even big vessels. You know what is interesting, guys? More than in 35-40% after the one-time removing of the extremity, in the first 10 minutes usually, you don't see any bleeding, even from big vessels. Why? Due to the over-compression of the muscles. Muscles is so much tense that they close even the big vessel. Of course, after, then the compressional effect will be decreased, then the muscles will be dilated, we will have formation of the secondary bleeding, and it will be by big chance the mortal bleeding, because whole surface will bleed it, and you will not be able to make any arrest of the bleeding in the region. So keep it in your mind. That's why I told you before that this is the angiovascular and the neurosurgical manipulation, because meticulously, one by one, all big regions of the region, all big vessels of the region should be found, should be accessed by the projectional line, and should be prepared. How we prepare the vessels, you know very well. For the arteries, 2 ligatures upwards, 1 ligature downwards. For the veins, 1 ligature upwards, 1 ligature downwards. So let's not speak about it once again. Continue, please. Next point. Right, please. Nerves should be found also by projectional lines. I speak about big nerves. And they should be sected, cutted, after possible retraction to downwards. In the brackets, right, please, to prevent involvement, of these nerves into the final scars. In the brackets, right, please, this is the prophylactics of phantom pains in the future. It is the prophylactics of the phantom pains in the future. What does it mean, guys? Meaning tension. You understand the level of your dissection. Now you must do your best to not have finally involvement of this tip of the cutted nerves inside of the final scar, because if they will be inside of the scar, they will be irritated. And the patient always will feel this pain sensation. So what we are doing, in that level, we maximally tense the nerve to downwards, and by one sharp movement, we cut it. Sometimes we inject it also some sclerotizing medicines in the tip of it, like the alcohol, 96%. Why? To prevent its regeneration. Because if it will be regenerated, it will form so-called nevrinomas. It is abnormal clot of the nerves in the tip of the extremity, because it cannot regenerate it up to the final place of location. And this is also will be the cause of the phantom pain formation. Let's say you tense it to down, if it is necessary you make it, and you cut it. After cutting, due to the constriction, it goes approximately 2-3 centimeters upwards to the final place of your dissection, and it loses the possibility to be involved inside of the final scar. Idea is understandable for you. So remember about it. Let's say in the future we will speak about it. And right, last point, please. You should form preficit of the soft tissues. You should form the preficit of the soft tissues. In the brackets, right, please, it is the muscles, it is the skin, or soft tissues with the bones. For example, osteomuscular form of the closure, yeah? What does it mean? So I will show you a little after. To close the tip of the bone and to form ideal stump. To close the tip of the bone and to form ideal stump. In the childhood, guys, paying attention to me, it is maximally important to save the metaphysis of the bone. Because as you understand, this is the growing place for the extremities. If you will not save the metaphysis, it will give the critical shortening of the extremities in this region. That's it. Generally, to tell the truth, the best method of the removing of extremity for the children, it is exarticulation. It is not amputation. Because you understand that this is continuous of the growing part of the bodies. If you don't keep the metaphysis, of course the problem of the shortening of the extremity you will achieve always in the future, and the effect of your future prothesis of the cutted extremity will be critically low. Let's say keep it in your mind maximally to save metaphysis. How it is possible. And if it is possible, instead of amputation, try to make the exarticulation. This is critically important in the child. Oh, okay, guys, that is, I think, enough. Now write, please, the types of the amputations or techniques of the amputations. Techniques of amputations. Write, please, in the choose of the technique of the amputation, influence the several factors. Number one, region of amputation. Number two, size of the cutting portion of the extremity, size of the cutting portion. Number three, level of amputation in each region. Level of amputation in each region. Generally, for all amputations, right, please, there are three main steps in the technique of amputation. Number one, it is incision of the soft tissues and formation of the flaps. Number two, it is the work with the bones. Number three, it is formation of the stump and closure of the wound. Formation of the stump and closure of the wound. Now write, please, according to these, all amputations can be divided into two big groups. Group number one, circular form of amputations. Group number two, it is the flap forms of amputations. Circular form of amputations and the flap form of amputation. Time is very short, let's say look to, and by this we will finish. What does it mean, circular form of amputation? Meaning attention. It is not the highlighting amputation, everything in one level. But remember, please, cutting line for each tissue has the ring form. Is it understandable? Let's say circular is called the amputation, then each tissue, not one tissue. All tissues, you cut it in circular way. What does it mean? Level of anterior incision for the same tissue and level of posterior medial lateral incisions will be in same one level. But meaning attention, different tissues we will cut in different levels. This is the most important point, because if everything I will cut in same circular level, finally due to the constriction, I will have impossibleness to close the bone. And I must make re-amputation, to make shortening of the extremity. That's why all tissues I cut it circularly, but in different levels. What does it mean? Generally imagine for yourself. For example, first of all, I cut the skin and fatty tissue. I wait 2-3 minutes, then they constrict it and goes to upwards. Finally, I tense it even little more to up and cut, for example, the second muscular layer. After this, we apply the hooks or special retractors to skin and muscles, maximally tense them to upwards, and in the highest level, we cut the bone with the deep muscles. What it gives for practical point of the view, you see that any next deeper structure, we cut in the more upper level. The lowest will be the skin flap, Under the skin flap will be the muscular flap. Above the muscular flap, we will have the bone flap. What is the main problem in the case of the circular amputation? Final scar located in geometrical midpoint of the stump. Because from in front, behind, medial and lateral, all soft tissues located in same level, then you make the final suturing of the structures. Geometrically, it is become to the midpoint. For the upper extremity, it is not problematical because you don't have pressure inside of the prothèse. For the lower extremity, usually it is not good. Why it's not good? Because the biggest pressure we have always in the lower surface of the stump. Of course, nowadays we have the unique prothesings, which is primary joint to anterior surface or to the posterior surface with some specific mechanism. Yeah? But anyhow, in the lower extremity, the best method, it is flap form methods. What does it mean? From anterior surface or from posterior surface, you forms the preficit of the soft tissues. In the flappy form, you cut, for example, skin and muscles. And using these flaps now, you close the stump of the bone. Of course, if anterior flap will be longer, final scar will be in posterior surface. If posterior flap will be longer, final scar. Samely, you can do it in medial or in the lateral surface. According to the tissues which is included inside of this flap, we can have skin flap, skin and muscular flap, skin, muscular, and bone flap. What does it mean? Even from bone, you saw the piece by which you close the inferior margin of the tubular bone. The best example for you. You, for example, save the patella, and by patella from downwards, you close the sewing femoral bone. Why it is important? Because then you just don't close by the bone sewing, by the bony flap sewing bone. Margin is thin and the pressure is very high. It can crash the soft tissues. You understand? Then you use this osteofacial muscular method. You use not only soft tissues to close the tip of the bone, but also the bony flaps. All these techniques is drawn and shown in the picture. Read, of course, in practical lesson we'll discuss it. But generally, this is the basic rules. Or you make circular section, but layers is different. According to the level based, by the way, it will be single moment, double moment, and triple. Of course, single moment, it is Hilliard method. If you provide it, for example, to save the life out of hospital, after you must make reamputation. Or you will not be able to close the stump. In case of double and triple moment, generally triple moment is better. Skin in one level, muscles in second level, bone in third level. You achieve stairs, but opposite stairs. And you have enough soft tissues to close the stump. Number of your groups?
301 and 2.
1 and 2?
Yes.
Dave?
15.
Hurry up, guys.